Hello, my name is Nathan Bhasin, and today I'm going to be talking about Medicaid, the history, how to apply, and other information about it. So, about Medicaid, it provides healthcare for millions of Americans around the nation. It is funded by the federal government and states. It is administered by the states themselves, and states have flexibility to determine which citizens and services to cover, also how to deliver the care, and how much to provide or how much to pay for providers. So the percentage of people covered by Medicaid, this ranges from 10 to 34% across different states. So for some states, it's very high. For some, it's relatively low. It all just depends on the state. So here's a image. It kind of shows the percent of people covered by Medicaid in 2021. So it's pretty high in states like California, Louisiana, New York. It's relatively lower in South Dakota, North Dakota, Utah, things like that. Yeah, Medicaid it helps a lot of people. Medicaid is the United States public health insurance for people with low income. It actually covers about one out of every five Americans, and it helps with things like paying for premiums, cost sharing, and other services. Here is another image. It shows the healthcare spending when it comes to Medicaid. So it shows out of pocket, private health insurance, Medicare, Medicaid, and all other. Yeah. So the history of Medicaid. On July 30th, 1965, Lyndon B. Johnson, who was the president at the time, signed a bill into law that created Medicaid. And over the years, more and more people have become eligible. This is seen in 1972 when Medicaid was expanded to cover disabled individuals. And there are different groups that are covered, which include low income families, pregnant women, people with disabilities, and people who need long term care. So, how to enroll in Medicaid? Here's like a short video I had that kind of walks you through how to actually enroll in Medicaid.
For more than 35 years, AmeriHealth Caritas has remained focused on helping Medicaid members get the care they need. For millions of Americans, Medicaid is a symbol of hope. It acts as a safety net to help increase access to important healthcare benefits and services and to help people get back on their feet. Eligibility for the program is determined by certain factors, including age, health, and financial status. That means if you're worried about losing your health insurance because you had your hours cut or lost a job, you may now be eligible for coverage under Medicaid. And if you have children, they could be covered too. Here's how to check your eligibility and apply. First, it is important to know that Medicaid eligibility varies by state. There are assessments online that can help determine if you qualify. But the only way to find out for sure is to fill out an application. Before applying, you'll want to search online for a Medicaid application checklist and make sure all your necessary documents are accessible. For example, you may need your ID showing proof of age, pay stubs or tax records showing your income, and proof of citizenship or immigration status. Once you have your documents ready, you're ready to fill out your application. To learn more and find where you can contact your state Medicaid agency, visit www.usa.gov/Medicaid. You can also apply by calling or visiting your local Medicaid application center. Medicaid can be the first step in getting back on your feet, and waiting for coverage doesn't have to be stressful. To help streamline the approval process, as of January 1st, 2020, 46 states and the District of Columbia can process applications and determine eligibility in just 24 hours. If you are eligible and your application is approved, you will then be asked to choose a health plan. To learn more about Medicaid managed care, visit www.amerihealthcaritas.com.
Yeah, so that was a video on how to apply for Medicaid. Here are some key points that I took away from the video that I think are important. So Medicaid acts as a safety net to help increase access to healthcare benefits and services. So it really helps a lot of people. Eligibility is determined by certain factors such as age, health, and financial status. If you lost your job, you can be eligible for Medicaid. Children will be covered too. Uh, and Medicaid eligibility varies by state, and there are assessments online to determine eligibility. So for part two of the key points, so when you apply for Medicaid, you need some important documents. These include ID showing your proof of age, pay stubs or tax records showing proof of income, and proof of citizenship or immigrant status. So to learn more about Medicaid, you can visit this website www.usa.gov/Medicaid. So when you click on that link, shows you how to apply for Medicaid, find out if you're eligible. Um, it shows what your eligibility is dependent on, so age, income level, number of people in your family, if you're pregnant or have a disability. So basically, these links right here are to create an account and like check if you're eligible. So yeah, this website is pretty useful to check your eligibility for Medicaid. Yeah. Um, so that yeah, again with Medicaid eligibility, so to participate in Medicaid, federal law requires states to cover certain groups of individuals, like I mentioned, pregnant, disabled. I'm going to talk about it in a little bit. So mandatory eligibility groups include low-income families, pregnant women and children, and individuals receiving Social Security income. So they can apply directly with the state and you can qualify for Medicaid if you're 65 or older, blind, disabled, under 21, pregnant in a nursing home, on a refugee status, or have cancer. So, what is covered under Medicaid? So, this includes doctor and dentist appointments, prescription drugs, vision care, family planning, and mental health care. Medicaid coverage also has provided access to necessary surgeries and treatments, such as foot surgery or a CPAP machine for sleep apnea. So here's an image. It kind of shows what benefits are covered under Medicaid in California. So outpatient, maternity and newborn care, physical and occupational therapy, emergency services, mental health and substance abuse treatment services, preventative and wellness services and chronic disease management, hospitalization, prescription medications, and dental and vision care. So when you're comparing Medicare versus Medicaid, there are a few differences. So for a person for Medicare, a person's Medicare costs will be the same no matter what state they live in. And then with Medicaid, each state runs their own program, so it could vary between states. So here's another image showing the difference between Medicare and Medicaid. So for Medicare, it's generally for people who are 65 and older or have a qualifying disability. Then with Medicaid, it's for individuals with families and children with limited income and resources. So there was a study that talked about some experiences with Medicaid. So when it comes to the health status for Medicaid enrollees, focus group participants reported a range of health conditions, including chronic pain, HIV, diabetes, substance use disorders, epilepsy, and anxiety and depression. Participants valued Medicaid coverage and noted that it enables them to access healthcare services, mental health services, and medications for themselves and their children. So here's a Medicaid story I'd like to share.
My son Anthony relies on Medicaid for all his needs. His life and my life would just not be the same without it. He depends on daily things that involve him having the Medicaid. The specialists, the medications, the PPEC services, all this is very, very expensive. And even with a private insurance, we wouldn't be able to have enough. So that's why I'm very thankful for the Medicaid that he has. And I just can't even imagine what his life and my life would be without that. I'm thankful that he has it.
Okay, so that was a video on a story of someone's experience with Medicaid. So that's it. Here are my references that I used. Yeah, thank you.